Keep it on the phones, and someone we've kind of chatted with a lot since this all started. He's a numbers geek. Self, I think that's how you describe yourself, right, Doc?
I suppose so. Numbers guy, sure.
Yeah, numbers guy. Okay. Dr. Peter Lombard. Just real quick, so I know you're crunching the numbers. What do you make of these last few days of test results, Doc? I'm curious your take on it.
I think everybody agrees. Definitely a positive sign, and it almost makes following the numbers. It's going to be boring here if all we see are zeros and ones every day, which is good. But even watching the charts isn't going to matter anymore. What matters more than anything is following any signal that there's a new cluster and outbreak happening. So you get 1, then 2, then 3, and then we're going to start to panic again and start watching a little bit more closely.
So I wanted to ask, what did you make of Dr. Shea's comments, Dr. Lombard, earlier on the show? If you guys didn't check that, you can go back and watch it later. But Dr. Shea basically saying that we can be hopeful, maybe.
Yeah, I think everybody's thinking that and feeling that. I don't think he's alone there. I'm certainly feeling pretty hopeful that the impending surge is definitely not coming. So I caught a little bit of what he was talking about, and I think everything that he said was pretty much on point there. We know that we're not out of the woods, and we don't want people to let their guard down. And want to stay on this course. Now we just there's so many unknowns, and that's the problem. There's so many unknowns, and everybody's going to be the expert now on how we get the economy restarted and what restrictions we're going to extend, how much, what signals we're going to look at.
Kind of losing you there, Doc.
What's that?
Kind of losing you there.
Oh, yes. Just saying everybody's going to have their own opinions now about which restrictions we can relax for how long, and what signals we're going to look at to say, hey, we need to tighten the restrictions again.
Yeah, I mean, is it early? The governor yesterday had said that they're saying the peak is coming later than we anticipated, and although she did kind of speak briefly on when she would start to talk about relaxing restrictions, I think for the most part they're like, it's just way too early.
Yeah, well, you got the sense that they're talking about it, and that's a good sign. And I don't know how candid she's able to be about how close they are to seriously be considering something like that. And all this talk about peaks is still, very much dependent on these models, which I think that we're finding that there are a lot of flaws to them. They show this big peak that's 2 months in the future. And the other problem I had initially with that model is that even in the countries that were way ahead of us, you weren't really seeing those countries follow the models that we were using at the time. And it's still the best thing that we had. But I think you've got to do a combination of modeling and also looking at what's happening elsewhere, and then using your own data and your own local specific details. We're an island. Dr. Shea alluded to that. We're an island. We can close our borders a lot better. Maybe we're doing a better job of containment and social isolation than other countries. And then there's all these just strange things that happen. Like why is New York hit so hard when they've got a lot of population density, but a lot of countries in Asia have just as much population density, but they're not having the same thing. Are they underreporting? Is it a factor? There's more obesity in New York. There's less mask wearing. There's so many unknowns, and that's been the hard part all along. So to move forward in a way that we can have any assurance that we're making the right decisions, it's going to be difficult.
What about mass testing, Doc? I mean, I haven't really put a lot of faith, just personally, in the test results because I don't think we're testing enough people. So it's kind of like, just for me, it's just too little of a snapshot. But I know you crunch the numbers. What can you tell us about mass testing, and are we ever going to get there? Because the governor clearly doesn't want anything to do with these South Korea tests. But we're getting some tests, but we're not getting 60,000.
Yeah. Well, we have to be pretty careful now about when we mention testing, which tests we're talking about, because as you I'm sure know, there's the serologic tests, which test the antibodies, and then there's the swabs, which tell you if you have active virus shedding. So consider for the moment, let's say we successfully starved the virus as a thought experiment. We're not going to get any new active tests anymore. So if all we do, we can test hundreds of people, and they're just all going to be negatives at this point. Now, those active throat swab tests, like the Abbott actually, is a very fast throat swab antigen test. They're going to be extremely valuable if we have new clusters show up. And because we weren't able to test a whole lot of people very quickly before, now if they identify one positive, they're going to be able to go out and do their tracings and just test a ton of people very quickly. So that, from that perspective, we should be able to respond to new clusters very quickly because of the expanded capability we have to do those antigen tests that should tell you if you have an active positive person. Now, the South Korean test, the antigen, the serology testing, it's fraught with complications and caveats, I should say. And you can get into that a little bit more through my blog post, but I think there's usefulness to it, even if the tests aren't as reliable as we would like for them to be.
Right. They said they're using it for surveillance.
Yeah. What does that mean, Doc? They're using it for surveillance.
It means you're gonna test a large portion of the population, not necessarily whether they have symptoms or if they even ask for it. You're gonna ask them, hey, can we test you? Whether or not, and if they agree to it, you test them, and then you can get an idea of if they come positive, meaning they've been exposed and they mounted an antibody response to the virus. Then you have an idea within that population of people what the percentage of people have been exposed to it at least. The ones that are positive, you immediately have to ask yourself, are they active? So that's why they're talking about you still have to back it up with the other type of test, the one, the throat swab to see if they're active. But the problem is, even if they're positive on the antibody test, it could be a false positive for a number of different reasons. There may be some cross-reactivity with other viruses, other types of coronaviruses that they've had in the past. So they've got some antibodies, and they're close enough that it matches this test. So they might have positive antibodies, but they're not actually, they maybe never were actually exposed to the COVID virus, which means you tell them that they're in the clear. Here's your immunity passport, and they go back to work, and then they get exposed, and they expose other people when they thought that they had already cleared the virus.
Right.
So there's a lot of caveats to it, but I still think that despite those caveats, I still think there is a place for surveillance testing and a place where we can use those type of tests. Now, the FDA approval thing just kind of throws a monkey wrench into everything. I don't understand quite what authority the states have to use non-FDA approved devices. There's definitely times as providers that we can decide if we think it's clinically indicated to do something what we call off-label or not use a medicine or a treatment in an off-label way, as long as the patients consent to that and they understand the risks and benefits that we're trying to get. So I don't understand how what difference there might be in Saipan that allows them to use these devices, or if any state can make that decision on their own. So there's still some unanswered questions there for me about that.
Yeah, but I felt like the response here, and I don't know how much of it is political. I think some of it is. They just ran over the idea of using these South Korean tests, and for all intents and purposes, it just looked like a really, really hard no.
Yeah, that's what they tend to do. They make a decision, and then they sort of they don't really give a thoughtful response. It's just like they'll give the reason why, and then just kind of stand behind that without any really good discussion about, well, is there any way that we could use these in a rational way? It's just, no, we decided this for safety reasons, and that's the end of it.
Let me read you this thing, Doc, that I just got. Sorry, Bree. Go ahead.
Oh, no, I just wanted to ask that the test kits, the rapid test kits that we are getting from Abbott Labs, are those serological, or are those, do you know if they're
They are
PCR?
not serologic tests.
Okay.
That's a good question.
Okay.
I think that because the word rapid's in there, a lot of people are thinking these are the serologic tests.
Mm-hmm.
These are not serologic tests. You do a throat swab, and then so you have the same complications or the same potential problem with not getting a good swab. Okay, you don't get a good swab, and it's still not going to be positive. But they sort of amplify virus particles, so you can detect if there's a virus on the swab.
Right, Doc. I wanted
Are
to
the ones in South Korea, ones in the CNMI, are those, do you know, serological?
I don't know for sure, but my guess is that they're serologic.
Okay. Good.
Okay, so I wanted to read this from FDA.gov, Doc. It's a policy for diagnostic tests for COVID-19 during the public health emergency. I'm just going to go right over to, there's a page. I can send you this if you want. Page 9, last paragraph here. The FDA requests that the state or territory notify us if they choose to use flexibility to expedite COVID-19 testing The FDA will not be reviewing the process adopted by the state or the territory, which we understand may be different than the process adopted by New York State. The FDA expects that such states, as part of their oversight process, will require laboratories developing COVID-19 tests to validate those tests prior to use. The FDA encourages laboratories that develop testing to send an email. So basically, it kind of seems like they're giving the states and the territories the flexibility they need, right?
That's certainly what it sounds like there. I've been to the FDA site too, and I get really confused.
Yeah, I know.
Go down these.
Well, that's not good because you're a doctor.
Yeah.
Oh yeah, I'll go down.
Don't say that out loud, Doc.
It's confusing. I mean, they have this emergency use authorization, and there's different EUAs. Like there's an EUA for what's called point of care testing. You can use it in the clinic or the hospital, and then there's EUA for laboratory testing, like it has to be done at DLS or at the public health lab. So some testing devices have EUAs already, and a lot of them don't. And I think there's a list published of the ones that have the EUA, and then there's probably a whole bunch more that have written that letter to the FDA, and they're sort of in the process of getting their EUA. And maybe some of the serology tests that we've ordered, maybe some of them will all of a sudden be on that EUA list. We'll be able to start utilizing those. I think that what we're doing in Guam, and I don't know, but I'm guessing that they want a little bit more reassurance instead of just saying we'll take any test that comes in. Let's at least make sure it's on the FDA list for EUA before we start using it. If you don't do that, it just makes things a little more complicated to write policy and how we're going to use the test. And that's, that's a separate issue, I suppose. If you're thoughtful about it and you put together a good policy that allows for us to do that in a way that
I'm just getting so much on the messages end, Doc, about this. People are sending me that these South Korean tests, they have preliminary FDA approval. It's really interesting in looking at how the governor and Dr. Cabrera talked about this, looking at what they said and what they didn't say. Now, what they didn't say was that, like you did, the states are getting, hundreds and thousands of these tests. What they did say is they weren't FDA approved, but what they didn't say was that there was a preliminary FDA approval. So,
well, I don't know if they either didn't have the time to get into more details, or they didn't want to, because to them it's just a closed issue. They're just going to make a decision and let's just move on to the next thing. And I don't know if states are using the non-FDA approved device. Actually, I haven't seen. I actually don't know the answer to that. Are any cities or states using the non-FDA?
I'm just looking at national media stuff, and WhatsApp is about to die from people sending me all these links about.
But like you said, moving forward, so we're going to be getting these 200 rapid test kits that from Abbott Labs, and they are.
I think they're being used already. I think in Guam.
Oh, already?
Remember, I think yesterday they reported some GMH test results, GMHA.
Okay.
Right,
and those.
But it was like 13 tests.
Yeah, I think that's the Abbott. Yeah, so I don't like you said earlier. I don't understand the numbers, but still.
Okay, no, that letter that they read, it was by Dr. Cruz, was that we have received a commitment to receive 200 rapid test kits, but I guess maybe they're already here. Sometimes I get confused with Linda, because Linda talks so fast, and so she says we have these Avid, or are they Abbott machines?
Abbott, ABBOTT.
So they are Abbott machines,
right?
Yeah, not Avid.
I think
Abbott.
The takeaway is, though, that we're not getting the 60,000 test kits. They're probably just not going to do it, because I noticed that if they say no, it's like no. There's no changing it. No matter if the speaker writes 10 more letters saying, "Oh, what about this or this?" There's not
but
going to do
Dr.
it.
Cruz said that also in that letter that if they are FDA approved, then
boom.
let's talk.
They're still working that issue for sure, and even though they're not saying everything that they could, but I know for sure that they're working on that issue as well.
Right.
So.
But we actually have Dr. Cabrera he's going to be calling in right after you, so we're going to ask him all these questions. Yeah.
He's way more important than I am. So.
Oh, come on.
But, there's no quarantine on opinions. What my friend said over here.
Right. Yeah.
Hey, Felix and I, we see eye to eye on a lot of things. That we had a nice chat the other day, and I think we are on the same page with a whole lot of what's going on here in Guam.
Right, and I think despite what people out here are saying about the zero positives, what I kind of base my feeling on is that the government of Guam is continuing to move forward, doing things like making more morgue space. doing things like standing up these fields. So the response from the government is continuing to go towards these projections and the bad case scenarios. So.
Right. And you wonder if at some point common sense will prevail and they'll say let's stop devoting resources to that. If it's no longer plausible, and they keep mentioning this word plausible, worst case scenario. Well, when are they going to adjust to say, okay, this is no longer plausible, let's not devote resources to it? And even the federal government, they're going to spend a ton of money putting up these field hospitals. At some point, will they say, yeah, let's scrap the idea? I don't know. Maybe we'll feel more comfortable if those hospitals are up, just in case. But again, if it's not plausible, should we devote our resources to that? And we're not the ones going to be making that decision.
Right on. So just listen up and you'll see what Dr. Cabrera has to say, Doc.
Okay. All right. Take care.
Thank you.
Take care.
I feel like I'm at the hospital. There's so many doctors. I got Dr. Shea, Dr. Cabrera, Dr. Lombard.
I don't like going to the hospital, but I like being informed like this. So.
Right. Yeah. So Dr. Cabrera, we're going to take a quick break. I'm going to get him on the phone again. Good morning to all of our Facebook Live listeners. There's just so many ways to catch the show. Thank you for watching the stream. Please share it as real information, real time. We're also obviously on I-94 FM. Thank you to Andy Wheeler, the Morning Brew, and the I-94 family for allowing us to come in here and do hopefully a temporary takeover. Okay. And also streaming on the KUAM news app, KUAM.com. There's an audio stream on Docomo Channel 10. And then in 20 minutes, we are going to jump over to KUAM TV 11, and you guys get to see our cute outfits.